everybody, it's Dr. Joe, and today I'm going to show you the best ways to improve knee range of motion after something like a total knee replacement, ACL repair, or just a general knee injury. So let's get started. Disclaimer alert, disclaimer alert. So for these stretches and exercises, make sure that if you've had a specific surgery that you're cleared to do these, because things like an ACL repair, you're on certain precautions in the beginning, so just make sure that you're cleared to do these or that you know your limitations and precautions before you start. So the first one is just going to be a simple heel slide. I'm on the floor. If you can't get on the floor, especially if you've had a surgery, you can do this on your bed, you can do it on your couch. You don't have to get all the way onto the floor. So with a heel slide, usually the best way to do it is to lie all the way down, just so you can get comfortable and relaxed. I like to leave the other side propped up just because that takes a little pressure off of your back and because it gives you a little bit of pull for the other side. So it's just like it sounds. You're just sliding your heel up towards you. So you're just going to pull that heel and try and bring up that bend as much as you can. Now, if you've just had a surgery, most likely you're not going to be able to come all the way up this far. You might only be able to get about to right here. So try and hold it for about 2 to 3 seconds and then slide back down. If you're having a hard time doing that, you can take a belt or a strap or something to help kind of give you a pull. If you've got a loop, that works great, and just put it around your ankle and then lie back down, and then as you come up, you can use the strap to kind of help pull a little bit up more. So it's going to feel really tight, especially after the surgery, especially after a big injury. Just again, try and hold it for about 2 or 3 seconds and then slide back down. So depending on what your injury or surgery is, I would just start off with maybe 2 sets of 10, doing the 2 to 3 second holds and work your way up from there. But it just really depends on what's going on with your knee. So the next one is then just while you're lying down doing a knee prop to help getting the straightening out. So the first one was for the bending or that knee flexion. This one is for the straightening out or that knee extension. So again, if you've just had your surgery or injury, it might be really tight, it might be uncomfortable. So I would just start off with a little bit. This is just a small roll, it's a pull noodle, but eventually you can bring it up higher. And all you're gonna do is then just lie down and really try and relax your leg. So the goal is to let gravity push that knee down. And if you have, maybe not quite full extension or straightening out yet, you're here. So if you can relax, eventually it'll just let go a little bit. So this one, you probably want to hold it for 2 or 3 minutes and build your way up to about maybe 5-10 minutes, depending on how much more that you need. But the goal is to get your leg up off of the ground, so propping it up a little bit, and just let it relax. You can sit up doing it as well, but again, sometimes if you're lying all the way down, you can kind of relax your whole body. And then if you want to do a little bit of a push, you can, but don't push on the knee joint. Push higher up kind of on your thigh area and just give a little gentle push until you feel that stretch in there. And if you've had that surgery, you know that just even a little push is usually a lot of tension in there. So don't push too hard. Slow and steady stretching is really the best way to go. Another way to gain that motion, that flexion, that extension in the knee is to use something like an EMS or TENS unit to help get the muscle going. A lot of times after a surgery, especially the total knee replacements, especially the ACL repairs, your quad muscle isn't firing like it's supposed to. And the quad muscle has a lot to do with straightening out the knee, the movement of the kneecap. So if this muscle really isn't firing, then it's not doing what it's supposed to do, and then it also messes up your motion as well. So you really want that muscle firing. So the folks at Massage Therapy Concepts sent me their TENS EMS unit. And this is a really nice unit because it is a combination of both. And so you can do the TENS, which is the transcutaneous electrical nerve stimulation, which is for pain control, where you don't really want a contraction. And then the EMS, which is the electrical muscle stimulation, where you are trying to get that contraction. You're trying to activate that muscle. And so it's really nice to have the combination of both. And this unit is a really nice way to do that. They've got 12 different settings. Each setting is different for the TENS or the EMS, and This unit, unlike a lot of units, has a really good instruction manual, and it tells you what each one does. Some units don't have much of a instructions, just kind of just put it on and go. But so you can read in the instructions what each one does. So for this one, I'm going to use the 10, and you can see that it's a barbell, so it's kind of a good indication that that's for muscle building or trying to gain that muscle stimulation versus just a TENS, which, you know, some of the other ones, which is the pain control. So it also comes with 3 different pad sizings, which is really nice because depending on the area, is good to use the different sizes so you can get a little more specific. When I'm doing the EMS, I kind of like the middle sized ones just because you can kind of get that muscle group, which is really nice. EMS, you do want to be a little more specific where you're placing the electrodes. When you're doing a TENS, it doesn't have to be exact, but what you want to do is really get on that muscle belly. So if you can contract the muscle a little bit, you want to do that to try and find it. If you're in a PT clinic, sometimes they'll use a little electrode pin to kind of find where the muscle is activating, but you really want to kind of follow along where that muscle belly is, where you're trying to activate it. But if you've had that injury, if you've had some surgery, when you squeeze, that muscle might not activate. It might look like this if you're squeezing. You know, eventually you want to be able to see it squeezing, but sometimes that just doesn't happen. So I'm just going to kind of put these on, and when you're placing the electrodes, you don't want it to be on. If you have to end up moving it just a little bit, you want to go ahead and pause it or make sure that it's turned off when you're doing, just so you don't get any little bit of a shock somewhere else while you're doing it. So I have it here. And then, so you can see, let's say I want to go down to that one. So I just press it, and so it's really easy that it's nice and touch. You have your A channel and your B channel. So I'm just going to use the A channel for the EMS. And you can see that up there. So you can change it here, and you can change it on the side here as well. This is for the time. You can change the time there, and you can see the minutes up here. And then you can just press the ones that you want to go to. And here's the pause button, pause play button, if you want to move these a little bit, and you can see that they're all blinking when you pause it, and then you press play again. So when you're going, if you don't end up getting a muscle contraction like that, then you might want to change the setting and see what's going on, because sometimes different settings are going to work better for different people. So for a really good contraction, I'm going to use setting 7 and show you how that looks. So once I start taking it up, and you can see it's going up here, now you can see that contraction starting. So I'm not doing anything right now. I'm letting the unit do the work. But what you want to do is when you get that contraction started and you feel the unit doing it, you want to squeeze as well. So now I'm squeezing with it as well. And then when it lets go, I'm letting go. And so that's just helping those muscles activate. So with this, if you haven't done it before, you probably just want to start off with 3 to 5 minutes, because you're doing a quad set, you're squishing it down, trying to straighten out that knee as much as you can, but you don't really want to over fatigue that muscle. So I'm going to show you a couple other exercises sitting, but I'm going to use the TENS unit while I'm doing that. So if you're interested in purchasing the Massage Therapy Concepts TENS EMS unit, make sure and click on the link up there. So for the last exercise and stretches, I'm going to use the TENS portion of the unit. So with the TENS, this is really for pain control. This is just to help edge out the pain a little bit, to ease it off some. And so with the TENS, you can do 1 or 2 channels or 2 or 4 electrodes. I like the 4, which is all the way around. Just make sure each channel is crossing. So this is one here and here, and then the other one is crossing. So then those channels cross each other, and then you're getting that general pain control in the middle. When you're doing the 2 channels here, when you turn on the intensity, you then do A or B, and then switch it in the middle there, and then do it. So this is for comfort. You want it just to be taking that edge off just a little bit. And if you're getting a little bit of a contraction, you want to take it down just a little bit. So with this one, you're going to do a heel slide with a little bit of a tap. So what I'm going to do is just, now I'm sliding that heel back, and if it's tight right there, then I'm going to tap that heel a couple times. And that just kind of helps loosen it up a little bit. And then try and slide it just a little bit more. Tap, tap, tap. And then slide just a little bit more. So each time, give it a little tap, and you just go till you get a lot of pressure, not extreme pain, but tolerable pressure, and then hold it for about 10 to 15 seconds, and then slide back and start over. So the heel tapping does a really good job of helping you just slide a little bit more. So slide again a little bit, couple taps, and then slide back some more. So again, you can do, maybe 10 reps, 2 sets of 10 a couple times throughout the day. And then the last one is going to be then for the extension or straightening again. So of course that one is for the flexion or the bending. So then you're going to kind of prop up again, but when you're seated propping up, you're going to get a little bit more motion in there. So you can have it a little bit higher if you've got, a coffee table in front of you or an ottoman, but you want to be able to prop that leg up. So if you're still having a little bit of a bend there, you really just want to try and relax that leg, keep it propped up. If you want a little bit more pressure, again, you can push on it some with your hand, or if you have an ankle weight or something, you can set it on your thigh, but you don't want to put it directly on the knee joint. You want to put it up higher. If you don't actually have a weight, you can take a grocery bag and put maybe a couple cans of super vegetable in there, and then just put it through your leg. And again, put it on your thigh. Don't put it actually on that knee joint. And so just resting it there and relaxing, you can watch TV, you can work on your computer a little bit, and just let it get that stretch. Let gravity do its work just to help get that extension or that strengthening out motion. So if you're interested in purchasing the Massage Therapy Concepts TENS EMS unit, make sure and click on the link up there. And don't forget to subscribe by clicking down there. And remember, be safe, have fun, and I hope you feel better soon.